Hello, everyone. I am excited to be here with you again today. It's kind of funny. I'm a little chilly because I've I have all sorts of things plugged into the same line here at my house, including all the lights and the heater here in my cottage and all of my grow mats out in my greenhouse. And unfortunately, all the grow mats are going strong right now, so they're using all the electricity. So I keep blowing all my circuits. So right now, I do not have lights or a heater on, but that's okay because I have other ways to stay warm, including a coat and all kinds of things. So that's how it works when you're here on the homestead. Um, if you have not signed up and you would like to, tonight is my garden design class, and this is my most popular class. This is the one that people show up for all the time because gardening is honestly, it's actually been proven. Research has shown that it is America's number one pastime. I think it's even passed up baseball now. So everybody loves to garden, everybody wants to garden, but often doesn't know how. And it's another thing too. I you will hear people say a lot of times things like, well, I'll just start gardening if things go bad, if the world goes bad. Well, if you were around in 2020, you realize that when the world goes bad pretty darn quick. It happens fast. And not only that, but I was just shocked when that happened at the way that supply chains just fell apart. We went from being able to get food anywhere, any time of the day, anything we wanted, to nothing on the shelves. I mean, I couldn't find butter anywhere. I couldn't find flour anywhere. It was crazy. So if you are interested in learning how to become more self-sufficient in just growing anything somewhere, something somewhere, even if it's just, on your windowsill or in a box in your kitchen, wherever it might be, or if you really do want to tackle a garden this year, even if it's in a flower bed or a pot on your back porch, whatever it is, join me tonight. Go on the livingwellwithdrmichelle.com site. You can see information there for signing up for the course, either in person here. I think we have about 25 people joining us here in person, which is always fun for me, or online. You can join from anywhere in the world. We're going to be going through all things garden design related. So what do you plant? Where do you plant it? When do you plant it? How do you grow it? All of those kinds of things are going to be covered today. How much room should you give per person? Should you do boxes or in the ground? And how do you prepare that ground? All of that. If this is something that interests you, sign up. Join us tonight. That's going to be fun. So it's tonight at 7 p.m. All right, let's jump into some questions. I think we already have some. Oh, good. Perfect. We have instructions on how to do that here. All right, we already have a couple questions coming through. Once upon a time, did you mention that there's an enzyme to help with kids wetting the bed at night? Interesting. Okay, so that's an interesting question. What I said is that actually there is a hormone that's in the body that will turn off the need to go to the bathroom at night. So this is why we typically can't go 3 or 4 hours during the day without going to the restroom, but during the nighttime we can go 6, 8 hours and we're okay. So there's a intrinsic system inside the body that allows us to do that, that turns off the need to go to the bathroom. However, if you are not getting enough air at night, what happens is that things will process differently, more carbon dioxide because you're not getting enough air, and it'll actually build up as ammonia in the system. Well, ammonia is very irritating to the bladder. So if you have a buildup of ammonia, what happens is that it will stimulate the bladder to empty. So this is often the reason that kids are wetting the bed. If they're wetting the bed at night, it is because they're not getting enough oxygen, leading to ammonia buildup, leading to irritation to the bladder, and it then empties. So this is a sign you need to look into sleep issues. If you are local to us, we have a Total Care Kids department that addresses all of this in person. If you are not local, I recommend you look up something called Tooth Pillow, toothpillow.com. And they are a virtual system that can help with kiddos and airway issues. So airway affects growth and development. It affects ADHD symptoms, focus, attention. It affects just size, stature. If you feel like your child is real small, it might be that they're not getting enough oxygen. What are signs to look for? Bedwetting, obviously. What are signs to look for? If you hear them grinding their teeth at all, this is a sign they're not getting enough air. If you see their teeth are rubbing or wearing out, they're not getting enough air. If you hear any loud breathing or snoring at all in a child, that is not okay. That means they're not getting enough air. So all of these things are things you need to look for. So that bedwetting is actually a sign that they're not getting enough air. All right, why is there both calcium and magnesium in the tooth and bone formula when they compete with each other for getting absorbed instead of one getting flushed out because the other beat it out? It's even advised to not take magnesium with calcium rich foods. Okay, great question. So, what we're trying to do with tooth and bone with the tooth and bone formula is we're actually trying to rebuild teeth. And rebuilding teeth requires both calcium and magnesium. So, do they compete with one another? Perhaps in some metabolic systems, but in your tooth, they require both. So we need to add both to the system so that both are available to be taken up into the tooth. Calcium is as strong as is a piece of a part of the actual hydroxyapatite crystal. It's a calcium phosphate molecule, and magnesium is necessary. It's also a trace element in teeth and bones, both, but it's necessary for those things to be taken into the tooth and the bone. So they're necessary, and we put them together in a synergistic amount so that they will not compete, so that they'll actually both be able to be taken up into the teeth and the bones. It's a well-researched product actually that shows increase in bone density and in tooth enamel density when used in the amounts that it's used in. So if you don't know what I'm talking about, that's our tooth and bone formula. That's on the livingwell with drmichelle.com site as well. And it's part of our remineralization protocols. So we will use tooth and bone formula for inside along with vitamin D and K. And then on the outside, we use the tooth powder and the mouth rinse, both that have hydroxyapatite. Besides vitamin D and K, ozone and PRF, what else can I do to help heal post extraction? So, that actually is a great question that we literally just answered. So, that's perfect. So, this is just asking, when you have a tooth removed, what can you do to help heal quicker? So, the first thing you need to do is think about building blocks. And I always tell people this: if you're building a house and you have no materials to build the house, how do you expect it to be built? It can't be. So either you're not eating enough of those nutrients, which are going to be minerals, largely vitamin D, vitamin K. Those are the things that teeth and bone require to heal. So, number one, if you're not eating enough, then you're not going to get enough in. Number two, if you're not absorbing enough. So, if your gut is not working properly, if you think this might be a problem, check out our gut health guide on the website. It's a free resource. You can learn exactly what might be happening with your gut. So check that out. Those are two reasons why you might not be healing well, is if you're not getting enough. So add to the vitamin D and K, you need to add tooth and bone formula, which is the minerals. We always do ozone and PRF. PRF is stem cells that we use in the site. But then postoperatively, what we do is we will do a vitamin C IV. And there's a lot of IV services around nowadays. So you can get a nutrient IV, which is very good for healing. We also recommend red light therapy. And Usui is the brand that we like. We used to be able to easily get them on Amazon, but we're not easily finding them as much anymore. I think you can still find them there if you search for it. I think it's spelled like USIUE, something like that. It's kind of an odd name, but it looks like a little flashlight, a little red light flashlight that you can use on these sites. And there is a lot of research showing that does stimulate healing. It turns on basically the metabolic processes that lead to healing in those jaw bones. So those are all excellent things to do postoperatively. And if you don't have IVs available, just do lots of vitamin C. Vitamin C is an antioxidant. It's going to help to create an environment that's best for healing. What causes swollen tongue in the morning? Interesting question. A lot of times the swollen tongue comes from mouth breathing. Mouth breathing is one. So if you're breathing through your mouth, it's drying out that tongue. It gets really kind of swollen and a leathery feeling. It just feels terrible. But another reason is if you are really struggling to breathe at night, you'll squeeze your teeth. It sucks the tongue into the sides of the teeth to try to flatten it out and make more room for air to get through. So it'll often create kind of the scalloping on the sides of the tongue and that sore swollen tongue. So again, tongue swollen is a good sign that things may be going on from an airway standpoint when you're breathing. Get a sleep study, see what's happening. A CT scan, see what's happening. My 8-year-old missing adult canines, advice for that. So usually canines aren't the ones missing. It's usually what are called the laterals. And this tooth, I was born without it. That tooth was little teeny tiny. And that's a real common thing to have, is a real teeny tiny tooth on one side and a missing one on the other. It may be the canine. Again, that's an infrequent tooth to be missed. But what we do, anything on an 8-year-old that's missing a tooth, is we first of all try to keep the baby tooth there as long as possible, because the baby tooth will hold the space. Now on me, I actually had an interesting experience. Again, like I said, I'm missing this tooth. Well, I was different day and age. I was sleeping in the back window of my mom's car. That's what we used to do. I had two younger brothers, I had four younger brothers, but for a long time, where there were just the three of us, and so we would fight over who got the back window, who got the seat. Of course, the seat was the much preferred place to sleep, and then who got the floor. The floor was the worst because it had that bump in the middle. If you guys remember, was there was the bottom, there was the bump, and then there was the bottom again. The floor was terrible because it had that bump. So we'd always try to make our youngest brother go down there because he could fit in one half of the side. Anyway, long story. I was sleeping in the window, and we hit a deer, and it threw all of us forward. I fell out of that window. I hit the back of my mom's seat, and it knocked my baby tooth out. So I was without even my baby tooth. Preferably, we'd like to keep that baby tooth in as long as possible. If the baby tooth is lost prematurely because of cavities, or you get hit, you hit a deer and you fall out of a window, whatever it might be, we will put something temporary in the space. Sometimes it's, if we're already doing braces, we'll put a tooth in there. Sometimes we'll glue a tooth in there. Sometimes it'll be on a retainer that comes in and out. Whatever it might be, we need to hold the space for the baby tooth until they're old enough to replace it with a dental implant, which for a girl is somewhere around 19. For a boy, sometimes is upwards of 21. Basically, it's when you stop growing. So we need to hold the space for now and then replace it when they're old enough. Do you have a non-toxic toothbrush you recommend for the whole family? Yes, and it'll be coming very soon. We should have this by hopefully middle to end of April on the website. It's bamboo. So I love bamboo. And then we have BPA-free bristles. So it's bamboo for the handle. It's biodegradable. And then BPA-free bristles. I did not go with boar bristles just because of there's issues with that. A lot of different issues with that, but particularly for those that are vegan that don't want to use an animal product. So it is a BPA-free bristle, bamboo handle. You can find them now on Amazon and things, but we will have ours on the website soon. And we have a kids version and an adults version, and they're really inexpensive. I think you're going to love them. Liver detox for teens. Well, liver detox for anybody is pretty much the same. You can find some really good gallbladder. I would even start with a gallbladder detox, and there's methods that you can go through. You take a certain amount of apple juice, that kind of thing for a little while. You have a real acidic medium, so lemon juice, and then you add olive oil, and it'll often pull all those stones out. Again, you can find a lot of these detoxes online that'll help walk you through that. How do you take care of gum disease? Do you recommend any supplements or procedures? So gum disease it's a combination disease. It's a combination between local factors. It's often due to buildup on the teeth that is below the level that your toothbrush or floss can reach. If there's buildup on the tooth well below the level that anything can get to, then we have to get to that. We go in, we clean that. So that's a procedure. It's called scaling and root planing. Sounds kind of terrible. What it is basically we're cleaning off all of that buildup on the sides of the tooth, all the way onto the root if necessary. So we have to remove it to be able to allow the gums to then reattach to the tooth. That's one half. The other half is systemic. So there's often a correlation between diabetes, blood sugar regulation, just immune strength, and gum disease. So if you're struggling with gum disease and your teeth are squeaky clean, you've been to the dentist, you have had everything taken care of, everything is off, then this is a systemic issue. You need to look and see, okay, what is my immune system doing? Is there something that's impacting it? Sometimes we'll find reasons for this in the mouth. We'll find an old infected root canal that's impacting your immune system. We'll find areas where wisdom teeth didn't heal right that are affecting immune system. So we start to look at systemic problems. Blood sugar control. Let's see, do you have, high blood sugar? Is this a pre-diabetes situation? Those things will all impact gum disease. So first of all, make sure everything's off the teeth. Have the dentist, the hygienist help you with that. Number two is let's see what systemically is going on. At home, you can add some things. My mouth rinse is actually specifically designed for gum disease, especially. So rinse with that every single day, and you'll be surprised at how much that will help once the teeth are cleaned. Do we ever do root canals, or are you totally against them? I personally don't do them. That's probably been about 8 years or so that I just had to kind of draw that line in the sand where my practice does not do any kind of root canal at all. Do we recommend them? Well, on a rare occasion, we always tell people that that's an option because legally we are required to do that. We're required to tell you that a root canal is always an option. And we have a great endodontist that we refer to and work with that can have that done. What is the time when I say, you know what, maybe this is your best option? That's going to be in a situation like a child who's broken a front tooth. has an abscess on a back tooth, something like that. And particularly a break is actually a good indication. The abscess is actually a worst example, because if it is already infected, then the rate of recurrence of that infection is going to be really high. Whereas if you've just broken a tooth, say you just fractured this tooth off and it broke it right into the nerve, it's not already infected. So that can be cleaned out, sealed up as a root canal, and probably last some years before the bacteria find it and reinfect it. I just had a girl yesterday, actually, though, that she had a root canal done when she was 12 on a front tooth. And she said, in my gut, I just wondered if this was okay. When looked at it, she has a huge abscess, probably about the size of a pencil eraser around the end of her front tooth, and it's eaten away all the bone. So the problem is now it's going to be difficult to do an implant there without quite a bit of reconstruction, because we're going to have to rebuild the bone, place the implant. So ideally, if we're doing a root canal like that, something that'll last a little while, we're keeping a real close eye on it. We're taking CT scans every couple of years to make sure that there isn't infection there, that the infection is not destroying bone. So also sometimes if you just don't have the money, or something's happening financially, life-wise, that you just need to get out of pain, well, maybe you get a root canal, knowing that that is a temporary solution. It's a placeholder. It's holding the place right there for a little while, for a few years. We're keeping a close eye on it with the CT scan. And then when things start to show trouble, then we'll take the next step to remove and replace that. So on occasion, we will. On occasion, we will. I'm not a purist. I don't say, there's never, ever, ever going to be a chance. No, I'm a realist. That sometimes life situations will dictate that we need that's an okay choice for right now. Choice is always yours, of course, too. I have a tooth that's been pulled that will be pulled soon. I have been battling swelling, bleeding, and severe throbbing pain. Is this a sign of abscess? Most likely, yes. That throbbing pain is down in the jawbone. Things aren't happy. Things are infected, not doing well. So yes, usually that throbbing pain is a sign of an abscess. So the sooner the better to get that tooth out. I have a permanent retainer across the front and bottom 6 teeth. Should I get that taken off after years and just use a plastic full mouth retainer? So it's interesting. I get this question a lot. And my answer is, why do we need to retain teeth in the spot that they're in to begin with? If teeth are stable, if there are no muscle issues, no tongue issues, like if teeth are where they belong in the mouth, they should retain in that spot. So I have an interesting experience that was my own experience. Again, I had a retainer on my bottom front teeth for probably 25 years. I mean, forever. And it didn't do anything. It didn't move at all, ever, for that entire time. And then I went and I had some cranial work done where they actually manipulated my head and tried to get some things, flowing a little bit better there. The next day, my retainer popped off. And I didn't put 2 and 2 together. I was like, oh, wow, that after 25 years, no sign that it had been loose, but there it went. The next day, I thought, it's because my head moved. It's because we moved the sutures in my skull, literally, because this retainer is actually holding everything here in place as well. And it may not be a good thing, especially a top one, because there's a suture here that actually ebbs and flows with the cerebral spinal fluid, with the pump of the cerebral spinal fluid. So I don't like fixed retainers for that reason, is that they're actually holding things in a very fixed position that may not be the best for brain function and for head function. So I do prefer a removable retainer because it does come off if you need a retainer at all. My retainer came off. I didn't replace it. My teeth moved slightly, but you can see they're pretty straight. And I haven't worn a retainer since. And that's probably been at least 5 years from now. So you may not need one. You may not need one. Okay, since my autoimmune came into play, my teeth have turned too yellow in color and are way more crowded. There's a white patch in the tongue and a weird odor. Any advice I should follow? So first of all, autoimmune disease is going to affect your immune system, but it also may be affecting your gut. Typically, when we see teeth turning yellow, what that means is that the enamel is being eroded or dissolved off of the front of the tooth. Teeth have a couple of different layers. They have they have the nerve on the inside, then dentin, then enamel. Well, the dentin is yellow. So the enamel actually masks the color of the dentin. If your teeth are yellowing, it means that the enamel is getting thinner and you're starting to see more of that yellow dentin layer. So if your teeth are yellowing, most likely your body is not absorbing nutrients properly after this disease started, and it is starting to pull minerals from your teeth to feed the rest of you. So this is a sign you need to remineralize. Yellowing teeth is absolutely 100% you need to remineralize. So remineralization kit, which is tooth and bone formula, vitamin D and K, and the tooth powder. Start doing that. You're going to notice a change with that yellowing. Tongue, a white patch on the tongue. So it depends on where it's at. Go online and look up tongue mapping. It's kind of an interesting one, but look it up. You'll see that the heart's right in the front, the liver is on the side, the intestines are kind of in the back. So go look on tongue mapping and then look at where that patch is. Most likely that is the organ that has been affected. So go check it out. The tongue scraper does help to clear it up, but I also always like to read the sign of where it's at. What does that mean? With a weird odor, again, most likely something's going on systemically you need to pay attention to. What are my thoughts on dental work while pregnant and nursing? So, my thoughts about that are that it is some things are safe, some things are not. While pregnant, we typically like to do things during the second trimester for a couple of reasons. I like to get you through the first trimester for safety reasons. Third trimester, you're usually too uncomfortable to be in our chair. So, second trimester is when I like to get that done. We don't do any kind of sedative because it does transfer to baby 100% all the time. We also don't like to do mercury removal because that will get detoxed into baby 100% of the time. So, typical instructions go for nursing. We don't do sedation because it will get transferred to baby, and we don't do mercury removal. Now, if you have other dental work that needs to happen, so fillings, anything that's emergency based, so you need a tooth out, an implant placed, that kind of thing, it can all be done during second trimester or nursing, but without sedation. That doesn't mean without numbing. You can get numb. You can get a local anesthetic, the lidocaine that we use. You can do that. You just can't be put to sleep. That medication will sedate your baby too, and you don't want that to happen. I'm going to jump off of here and grab a couple on here now. Do you think kids should get fluoride put on after their cleanings? Their dentist strongly encourages it along with toothpaste. What are your thoughts on? So, first of all, let's answer that one. Do you think kids should get fluoride put on after their cleanings? I do not. We actually in our office use a hydroxyapatite varnish instead of a fluoride varnish. You can do this at home. There's actually a company called Fig, Fygg, that has a hydroxyapatite varnish that is used in dental offices, but it can actually be used at home as well. So we use hydroxyapatite in place of fluoride all the time. You can do this at home. My husband, what are your thoughts on root canals? I do not believe in root canals for many reasons. Go check out my website. You can see a lot of information there. Also on social media, lots of information about root canals. You just can't completely clean them, no matter what. They can't be completely cleaned because of the anatomy of the tooth. So we see a real high rate of recurrent infection. You can't feel it because the tooth doesn't have a nerve anymore. And so you aren't aware that bone is being eroded, infection is spreading through the body, and it's starting from the tooth. My husband had a filling, but is still having pain, and they are suggesting a root canal. So if the filling is still having pain, these are the signs you're going to look for. Number one, is the tooth hot or cold sensitive? If so, that tooth is still alive. That's a very good sign. It means it doesn't need a root canal. It means that most likely the filling needs to be replaced. If it hurts to bite on, again, if it hurts to bite on all the time, meaning you just even touch that tooth, anything like that hurts to bite, even to touch that tooth is just dying, that tooth is probably dead and is going to need to be removed or a root canal. If the tooth just hurts when you bite on something hard, so if you put something hard in there, a hard carrot, it gets a seed, something caught, it's probably a fault with the filling. Sometimes an air bubble will get stuck underneath the filling and it will hurt to bite on. So if it's hot and cold sensitive, if it's just the filling, biting on the filling hurts, then that filling needs to be redone. I would recommend having that redone very, very carefully with a desensitizer underneath there and see if they can't get it to get filling better. If it's hurting all the time, if it hurts by itself without them chewing on it, if it aches down in the jawbone, that tooth is dead or dying and you'll have to make a choice between a root canal or removing and replacing that one. Do you think you need to have all root canals removed before getting a sinus lift because infections make healing difficult? Great question. So sinus lift is an area where the sinus needs to be lifted up some to be able to allow more room for an implant. Well, if a root canal is next to that area or is in that same vicinity, it really will probably impact healing. It will impact healing because there may be infection on that root canal that's also going to impact whether that bone's going to regenerate and heal very well. Let's say you're doing the sinus lift here and you have an old root canal here. That it will impact your healing just from an overall health standpoint, but it's not going to directly. So I would say that is much safer. If the root canal is somewhere else in the mouth and you're doing a sinus lift, I would recommend that. Okay. What causes excessive belching? So a lot of times that's open sphincter, pyloric sphincter. Basically too much air is getting down. So there are chiropractic techniques you can do. You can actually check out even online and look for ways to close the pyloric sphincter. Check that out and see if you can get some information there. That's usually what's happening with excessive. Basically, you're just swallowing too much air. When is the best time of day to take vitamin D and K along with magnesium? I usually do it first thing in the morning. And the reason I do it then is because I remember it. So I am, again, a realist. I don't remember it. If you tell me to take it at noon, never happening. If you tell me to take it in the evening, maybe half and half, 50-50. If I do it in the morning, I'll remember it pretty much every day. So that's the reason I do it then. Oh, someone else asked vitamin D and vitamin K, how much? So it depends on what you're using it for. If you're using it for maintenance, then typically 2 to 5,000 IUs of vitamin D3 a day with the equal amount of vitamin K, which is usually like 2 to 500 micrograms of vitamin K. If you're rebuilding bone, if you're healing teeth, you want a higher level. So I recommend 10,000 IUs of vitamin D with about a 1,200 micrograms of vitamin K, and that's vitamin K2. And our formula has it all together the same amount. We also have a liquid formula, and with the liquid, you can do it drop by drop. So you can kind of increase per you or your child or whoever. So you might want to check out the liquid one. Is it necessary to remove wisdom teeth? So this is also a question I get a lot, and the answer is it depends. Depends on how big your mouth is. If the mouth is big enough to allow room for the wisdom teeth, then no, I like the wisdom teeth to stay. But if the wisdom teeth are going to cause problems with the teeth in front of them, sometimes they'll sit sideways and they create a pocket there that can't be cleaned, and then you end up losing your other molar later. Well, those teeth need to be removed. So if there's no room for them to come in, they're going to cause problems, remove them. If there's room for them, we leave them alone. And actually, interestingly, one of the things I'm working on a lot with kids nowadays is helping to grow mouths large enough that there's room for wisdom teeth later. I love this concept. Grinding of teeth in young children. Grinding of teeth means that they are not getting enough air. Usually that's the reason. So when you grind your teeth, what it does is it engages the muscles in the throat. So that opens up the airway and air is able to pass better. So they grind in order to sleep better, in order to breathe better. So check out toothpillow.com if you're not near us, or come visit Total Care Kids and we'll give you a hand with that. Did I go to college for 8 years? Yes, I did. I went to undergraduate, and then I went to, dental school, and then I went back to school. So those were the original, the original degree to get a dental degree, and then I went back to school to, become a traditional naturopath. So that was another 3 years in addition to that, plus all the other education. So yeah, it's been well over 8 years by now. Can you get multiple root canals removed at once safely? Yes, you can get multiple root canals removed at once safely. Does an apicoectomy with silver amalgam and jaw cause a more difficult extraction than a regular root canal? So what an apicoectomy is if you have a failed root canal, what they'll do is they'll go in above it and they'll do a surgical root canal. So they'll go cut off the end of the root. So surgically go up and access the end of the root, cut it off. And in the old days, they would fill those end of the roots with mercury fillings, with silver amalgam mercury fillings. My favorite thing to find out. Does it cause a more difficult extraction? Not usually, although sometimes we do have to go and try to retrieve the mercury. Sometimes there's mercury particles that have embedded in the bone around where they did that surgery. So sometimes we have to go back in and try to find those mercury particles. That's the only thing that really makes it more difficult. If a kiddo has a brown spot on the back of his front tooth from a pacifier and milk, what can I do for that? A lot of times the brown spot is actually a developmental deficiency or developmental issue. So a lot of times if kiddos have a brown spot here on a front tooth or on a back molar, it's because there was some sort of high heat event. So fever event, strep throat, ear infection, something like that when the teeth were developing. So oftentimes 3 years old, 2 years old, sometime around there, they had a really high fever and it actually affected the growth and development of the tooth. If it's a baby tooth, it will come out. If it's a permanent tooth, it will not come out. It's difficult. You can't really bleach it. You really have to cover it over with a filling material. But you have to have a filling or something to fix it, or with kids' toothpaste maybe help. Good question. Exactly what I just answered. So if it's dark enough and it's big enough and it's on a permanent tooth, you're probably going to have a filling to fix it. Will increased greens and veggies consumption impact or improve yellowing of teeth? No, because, well, yes and no. It will not impact whether the enamel dissolves more, which we just talked about will lead to a yellower look of the tooth, because if we're seeing more dentin through the tooth, it's going to look more yellow. So it will not lead to that. However, greens will stain teeth. So sometimes it will actually impact the staining of the tooth, which the hydroxyapatite tooth powder will help immensely with that. Really, they can stain teeth, but they're not going to impact whether enamel dissolves more and you get yellower teeth that way. So more just a staining than anything. How do I find a dentist in my area? We'll put the link up on here, but we have a directory on our website, livingwellwithdrmichelle.com. There's a directory there of dentists who we've vetted and who we know do provide at least some of these services. Not all of them, but some of them. Why are we there we go. Well, very good. Directory, livingwithdrmichelle.com. Why are we having to replace fillings? You would need to replace a filling if a filling is broken, if there's new decay underneath it, or if it's mercury amalgam filling. If it has a lot of mercury in it, then that would be something that I would recommend getting removed if you have health symptoms that are related. That's what made me sick, was mercury. So a lot of symptoms might be memory related, any nervous system things, gut issues, and a lot of times just basically kind of overall feeling of just not feeling well often is a mercury piece too. Looking to have 2 non-metal implants placed in June or July. What kind of questions should I ask to feel safe and confident in the dentist doing my implants? So basically just ask, what is their experience in placing the zirconia implants? Is it something that they've done frequently? What brand are they using? Just see, are they able to converse about it? If they're able to converse about it, they've done enough of these, then I think you can feel confident that they know what they're doing. I'm wondering because my son is pursuing dental. Yeah, very good. Yes. So yes, wondering about the eight years. So yes, it's 4 years of undergraduate plus 4 years of dental school to be able to get your dental degree. And then if you want to do a residency, some sort of specialty, so an oral surgeon is going to go to 3 to 4 additional years. An orthodontist will be 2 more years. A pediatric dentist is going to be 2 additional years. So that's where they're at. That's where we're at for dental school and how long it takes. How to stop tooth migration when you have periodontitis? Well, periodontitis is gum disease, and those teeth are going to move because there's not bone supporting them. So what you're going to do to stop tooth migration is you're going to get on top of the gum disease. That's number one you have to tackle. So that's going to be going to visit your dentist, ozone. At home, you're going to be hitting it with a lot of vitamin D and K, tooth and bone formula, you're regrowing bone, regrowing teeth, lots of vitamin C. Those are all really important vitamins for gum disease. My son has braces and since the age of 15 has been wearing nighttime retainers. He's now 18. Should he still wear them? I would start doing every other and then go to every third day and see, are the teeth moving? If they're not moving, you may not have to do anything at all. How do we know if they're mercury? What about silver fillings? Any silver filling has 50% mercury in it. So there's no such thing as just a silver filling that doesn't have mercury in it. You can go back. There's lots of research and lots of information on this. Mercury fillings were invented in the 1800s. And at that time, they figured out that silver shavings combined with elemental mercury or liquid mercury would make a kind of a malleable, moldable paste. That's still the fillings that are used today. And so if you have any kind of metallic filling in your mouth, a silver filling in your mouth, it is 50% mercury. If it's gold, then no, there's no mercury in there, but that's the only metallic filling that does not have mercury in it. And gold are only gold inlays or onlays. They're actually very rare. We don't see a lot of them anymore. So if it's any kind of metallic filling, it's 50% mercury. Couple last ones here. Is there any possibility that removing a root canal might reverse brain fog and chronic fatigue? I see that happen every single day. I see that happen every single day where people remove root canals and it helps to reverse a lot of brain fog issues, chronic fatigue, all those kinds of things. What is the cause of lichen planus? I'm going to hurry, just see if I can get through the last few of these. What is the cause of lichen planus? Lichen planus is an autoimmune condition. So anytime somebody has a lichen planus, I'll often say, well, what's impacting your immune system? It might be an infection in the mouth. It might be an infection elsewhere. It might be something gut related. So we'll usually try to just get to the bottom of what's impacting the immune system because that's an autoimmune condition. What is the procedure after root planing? So root planing means cleaning the teeth, really getting them very well cleaned. Then that hygienist or dentist should be instructing you how to keep them clean at home. And you need to have them cleaned every 3 months professionally at the dentist. So that's the procedure after, is you're going to be every 3 months going to visit the dentist and getting those cleaned. And you're going to be doing a lot at home too. Do we have any recommendations for a holistic dentist in Ontario, Canada? Again, if we know of them, they're on our directory. So go check out our directory. How to stop. We already did that one. Thoughts on tooth pillow. I love tooth pillow. So if you have a child that you're wondering about needing airway issues, if they're grinding their teeth, they're clenching their teeth, they're bedwetting, they have ADHD issues, they're very small for their age, go check out tooth pillow. If you're near us, come visit us. And if not, check out tooth pillow. Do you think my tongue pressure pushing against my front teeth is related to the oxygen when I sleep? That's the worst time for me. I wake up with headaches. Absolutely. So talking about tongue pushing forward. Well, if you think about when you lay down, what happens? The tongue's going to fall back into the back of the throat, especially when you get into deep sleep. If you're not getting enough air when the tongue falls back, then the tongue will have to push forward to make more room. So most likely you need to get a sleep study and find out what's going on with your sleep and why that's happening. If an adult has signs of oral ties or some occlusion issues causing sleep apnea, what is the first way to go about treatment? The first thing you're going to do is get a cone beam CT scan with a dentist that knows what they're doing, looking at it, and find out, is there something happening with my airway, with my bite that's causing apnea and other issues? So cone beam CT scan is the place to start. Airway dentist, myofunctional therapist. Yes, you're going to start with an airway dentist. Should I wait until my 7-year-old's first front teeth grow in prior to doing palatal expansion? Well, palatal expansion is easier when you have front teeth. However, it can start prior to that. It just prolongs treatment out a little bit. So a lot of times expanders we will wait until about that age. After the infection removal, can the tissue at the back of the airway shrink? Yes, and that's the reason we often will do it, because that tissue will swell and is very swollen and in the way and creates airway issues because of the infection in the mouth. So the problem can come, however, if that tissue is very stretched out. I'll always joke and say, if you lose 100 pounds, the weight's gone, but the tissue's still flabby. Sometimes we have to get the tissue to shrink from infection removal, and then we actually shrink it up more from a procedure called night laser, which is a laser that actually shrinks the collagen fibers and just shrinks that flabby tissue up and out of the way. All right. Thank you so much for questions. We'll grab the last of these. If Kathleen can grab the last of these, we'll put them on very first next week so that we can get to them very first. Thank you guys for being on here. I just love that you're here. I love that you're answering questions. And if some of you have questions here, we'll answer them on the chat online as well. So Kathleen, grab these, get them to me, and we'll answer on the chat online as well. If you were hoping that I really got to your question, but I got to jump off. I got another meeting to get to. Thank you all for being here. I love sharing. I love your questions. I love that you're interested in this. Keep coming back, and let's just get all your questions answered and share. Thank you all.